we're going to be moving into obstructive shock today. So, what is obstructive shock? That is a mechanical obstruction preventing the adequate amount of blood to fill our hearts and our chambers of our heart. Some causes of this is that cardiac muscles are created, a decrease in the cardiac output, and you're going to see dyspnea, rapid weak pulse, rapid to shallow breaths, decreasing in lung compliance, decrease to absent breathing sounds, decreased blood pressure, the jugular vein distension, the cyanosis, and the tracheal deviation is unaffected on the side. And the treatment is that you're going to want to have ALS assist with this one. You're going to have to transport the patient immediately, and you're going to want to administer that high flow of oxygen. In obstructive shock, there are 3 types, which is tension pneumothorax, cardiac panade, and pulmonary embolism. In tension pneumothorax, it is a damage to the lung tissue, but it also allows the air to hold the lung to escape the chest cavity, causing that tension. Some signs and symptoms is that you're definitely going to see the blood pressure drop, reduce the blood return into the right side of the heart. You're going to be anxious and shortness of breath. Your heart and respiratory rate are going to increase and are shallow. You're going to be decreased to almost absent lung sounds, becoming that cyanotic, and the tracheal deviation is what you're also going to want to look at. In the cardiac tamponade, you're going to want to look at, in this, it's what it is, effusion and outperfusion over time becomes larger, and it's preventing the ventricles from filling the blood, causing cardiac tamponade. And causes of this is a hemorrhage around the heart. And a good vocabulary word that you're going to want to remember is a pericardial effusion, and that's when we have built up fluid between the pericardial sac and the myocardium, and that's the hemorrhage around the heart that begins to form. And this is going to occur when the blood is weak into space between tough fibrous membranes such as the pericardium and the walls of the heart. And some signs and symptoms that you could be aware of this is that the patient could have possible cancer or autoimmune disease, the jugular vein again, the muffled heart sounds, the narrowing pulse pressure, the diastolic blood pressure merges, as in the systolic one, which is the top, is going to drop while the diastolic one is going to increase. And in the pulmonary embolism, it's a blood clot that happens in the pulmonary circulation and blocks the flow of blood through the pulmonary vessels. And it is it just prevents the blood from being able to pump on the right or the left side of the from the right to the left side of the heart, and it's going to lead a pool of blood into the right ventricle. And as soon as that happens, it's just pump failure. And of those all, that is obstructive shock. So in the next video,